I brought my friend with me. Thank you very much. Thank you, Dr. Insel. Your words are too kind. Dr. Insel is one of my only fans, but we're all Dr. Insel's fans, so thank you. And thank you to Dr. Insel's staff and to Tudor Heights for such a wonderful venue for tonight's program. So I will speak just as long as Rabbi Katz. I'm just joking. Dr. Insel told me 10 minutes, so I'll make it 5. How's that sound? So I was asked to speak about home safety, home emergency type things, and I was thinking we'd talk about some things that the younger generation calls life hacks, so that we can have some take-homes that we can apply in our homes. So when you think about home safety, we think about a few things. Number one, we have to think about prevention. And so when we look at our houses, we have to look how we could prevent problems from happening, and then we won't have to need to fix these things. So when we look at our homes, we should think about things like fire safety, smoke detectors, carbon monoxide detectors, hot items that could cause burns, because these are things that could injure you, things that can kill you that you're trying to prevent. As far as your homes we have injuries that occur in homes. A lot of people have clutter all about their homes, whether it be a carpet with a little curled up edge, whether it be people who keep boxes all over their living room and on their floors. All it takes is an empty can to trip on and break a hip and become injured. And so injuries are in general, they're preventable, and so we should really think about our environment and take a look and see what is there that might not be safe. Medical conditions. So there are very few medications that people take that I could think of that you take when you're having an acute flare of something. So at the moment of the intensification, I guess you could say, of your medical illness, there are very few oral pills that you take at that time. The pills you take are when you do feel good. And often we used to have patients that would come in and we would ask them, do you take your pills? They said, no, I don't take my pills because I feel okay. That's the time when you should take your pills, and that's when you can prevent a lot of the medical conditions from happening. So I was thinking about what 3 primary emergencies people have that we can kind of use as a life hack that we can take home with us. Keep in mind, for those of you who aren't familiar with these terms, I deal in university health now, and the average age of the person I deal with is probably 19 years old. So a lot of the stuff I deal with every day, fortunately, you all probably never even heard of, but you could use your imagination. But anyhow, I was thinking, how many people here consider themselves a pushy person? Raise your hand if you consider yourself a pushy person.
Pushy person?
Pushy person. Okay, so very few pushy people. I was thinking, the take-home message is that you have to be pushy, and let me explain to you what I'm talking about. The number one emergency that you can take care of by being pushy is severe bleeding, which will kill you, right? Choking, which will kill you, and cardiac arrest, which can kill you. So those 3 things, as long as you just push on what the problem is, then you actually can save the person's life or even save your own life. So what do I mean by that? So if someone has bleeding that can be seen, right? So how do you take care of bleeding that can be seen? You push on it. So you could take a gloved hand, a non-gloved hand, you could take a shirt, a sterile gauze, whatever you have available to you, and you simply just push on wherever the bleeding is, right? So you have to be pushy. And the more you take your hand off and take a look about how you're doing, the more it's going to start bleeding again, right? So you're going to hold your hand on there and you're going to leave your hand on there until someone else comes and helps you. So that's life hack number 1. Number 2 is when we think about someone who's choking. So you've all heard about what used to be called the Heimlich maneuver. The poor guy got the credit taken away from him somehow in recent years. Now they call it abdominal thrusts. You have someone who you suspect has an obstructed airway, meaning they're choking. So how do we clear that obstructed airway? We push, right? So we're going to make a fist, and we're going to put the fist just above the person's belly button, if everyone could see. Fist just above the belly button, and we're going to bear hug the person. We're going to grab that fist, and we're going to bear hug the person, and we're going to pull inward and upward like a J. So essentially we're pushing on the problem. And hopefully we'll send some air out of the person's lungs and we'll blast the object out, kind of like the internal spitball or plunger, and take the object out with it. So again, just by being pushy, you can save the person's life. You could do this on yourself. You could throw yourself over the back of a railing, sofa, chair, whatever you need to do to sort of push the wind out of yourself. And the last thing is cardiac arrest. And there's no reason in 2015, nearing 2016, when someone has a cardiac arrest, meaning they're laying on the ground, they don't look like they're alive, they're not responding to you, they're not breathing, there's no reason why that person should not be getting what's called hands-only CPR. Basically, you're pushing on their heart. Their heart's not beating, so you beat that person's heart for them. So very simply, you take your hands, and you're going to put your hands on what's called the lower half of the breastbone. It's not rocket science. Here's the bottom of the breastbone. Here's the top of the breastbone. There's only about one or two hand spaces in between. You're going to put your hand on the lower half of the breastbone. The person's going to be on a hard surface. And if you put your other hand on top of the hand that's already down, and you put your shoulders directly above your hands, which is hard for me to do on this podium, but probably people don't find themselves in this position. And you do something called push hard and fast. You push down what they call at least 2 inches deep, and don't overdo it, but at least 2 inches deep at a speed of at least 100 per minute, but don't overdo it. So a little more than 100 per minute, a little deeper than 2 inches deep, and you just push away on the bone. So you're just going to keep pushing down like this, and what you're doing is the heart is underneath, and you are pumping the person's blood until help can arrive. So those are the 3 life hacks I could think of for being pushy and to save a life at the same time. So thank you very much. Yes. Right, so that could be helpful, but in 2015, that's found not to be the most important thing that the person needs. So pushing is what's most important.
So they dropped the idea of breathing in.
They didn't drop it completely. It is something that could be helpful as well, but certainly in the first few minutes of cardiac arrest with the adult, compressions alone are equivalent to compressions with breaths, so that means compressions alone are good. Yes?
If a person's lying prone in front of you, how do you know if they didn't have a stroke or they fell and broke a bone? How do we know to start pushing on their chest?
Right, so good question. So if somebody has no sign of life, meaning they don't respond to you and they don't appear to be breathing, for the lay person, that's a good enough sign that they need you to push on their chest, and you just roll them over and do it. People who look like they're breathing, look like they're breathing. So people who had a stroke are probably breathing. People who are having a diabetic emergency are probably breathing. People who had a drug overdose may or may not look like they're breathing. But if they don't look like they're breathing, they need you to pump on them. Yes?
Is there a modification for pregnant women for the habit maneuver?
Yes, good question. But that's called pulling, so that's a little bit more challenging. Now, so good question. So if you're trying to bear hug somebody who is pregnant or morbidly obese, you are not going to hit up underneath the lungs and send air out. So for those folks, you can do something called chest thrusts. So you can make a fist and you can put on the lower half of the breastbone, so on the hard part, just like you did for CPR, just for those chest compressions. And this time, bear hug them straight in, in hopes that you'll blast some air out that way. So good question.
One more question. Okay,
Yes.
Is it that tune, there was a tune that they gave for how fast to be alive?
Right.
Staying alive, thank you. Does that work?
That works. Whatever you need in order to kind of keep the beat going.
which part of the breastbone?
It's the lower half. But okay, so people fixate on this lower half thing. I'll just show you. I'm over 6'1". Here's the bottom of my breastbone. Here's the top of my breastbone. So how much room is there anyhow? So people who are shorter than me, there's just basically one spot. Oh, you're right in the middle. Right in the middle. Okay, the breastbone's running straight down the middle. So again, if you're on the lower half, you're in the center, it doesn't really make much of a difference. Thank you.
We'll be available for questions.